Revision of ophthalmology, anatomy and nomenclature of eyeball. Eyeball shape is spheroidal, volume 6.5 ml, weight 7 grams, circumference 7.5 cm. There are three layers of the eyeball. Outer fibrous layer is for protection and is also known as tunica fibrosa, middle vascular and inner neural. Middle vascular layer is also known as uvea for nutrition, and inner neural layer is also known for vision. Outer fibrous layer is contained two structure, cornea and sclera. Anterior 1/6 formed by cornea and it is also known as sclera. Sclera form the posterior 5/6 part, and the junction of the cornea and the sclera is known as limbus. Middle vascular is for nutrition and it contains three structures: iris, ciliary body, and a choroid. Central aperture of the iris is also known as pupil or chorea. Anterior part of the ciliary body is pars plicata and the posterior is pars plana. Relatively avascular layer of the ciliary body is posterior part. Choroid. Ciliary body and choroid junction is known as ora serrata. Inner neural is formed by the fundus and retina. From ora serrata to optic disc margins, it is formed by the retina. Anatomy and the nomenclature of the eyeball. Whenever we see the eyeball from the front, we can see the cornea, ciliary body from anterior to the posterior, cornea, ciliary body, and the iris, in the hole in the iris, and behind the iris it is lens, and lens is held by the zonules, which is by ciliary body, and behind the lens it is formed by the posterior segment. It is formed by retina, sclera, optic nerve, zonules, choroid, etc. Optic disc is also known as papilla, is an aperture in the sclera. Eyeball shape is spheroidal, volume 6.5, weight 7 kg and circumference 7.5. Anatomical species. There in eyeball there are two segments. Anterior segment is divided into two chambers, anterior chamber and the posterior chamber. Anterior chamber is from the posterior part of the cornea to the anterior part of the sclera, and posterior chamber is from the anterior part from the iris to the anterior part of the post vitreous. Intrazonular space is also known as canal of Hanover, and a canal of Petit is also known as it is a space in between the zonules and the anterior part of the vitreous. Anterior segments contains aqueous humor and volume approximately 0.31 ml. 99.9% are water, has high concentration of the lactate, chlorine, and vitamin C. Posterior part of the lens is demarcation between two segments. Posterior part of the lens is the demarcation between the two segments, posterior and the anterior. Posterior segments contains the vitreous humor, has high concentration of the collagen, hyaluronate, vitamin C. Collagen and hyaluronate are the gel, and vitreous is also known as hyaloid. Volume of the vitreous is 4 ml, 99% of the water content. Anterior vitreous is also known as the agar line, condenses to form the Weigert ligament, creating a Burgers space forming patellar fossa. It's like a fossa of the patellar fossa, and a space which is formed. This space is known as Burger, and the vitreous containing is known as the Weigert ligament. The canal from the optic canals to the posterior part of the lens is known as the cloacaed canal. Contains highlight vessels in the congenital stage, primary vitreous form. It also covers the lens as tunica vasculosa lentis. Regresses by 8 months of intrauterine life. Blepharo or palpebrae, it's known as other name of the eyelids. But in the bulbar and the palpebral conjunctiva, how we can differentiate? Bulbar, it is when the conjunctiva is attaches to the cornea, and the palpebral conjunctiva is attached to the eyelids, and in between these two junction we can see the corner. It is formed by it is known as fornix. In one eye has four fornix: upper, lower, and lateral and medial. Episclera covers entire sclera. Tendons capsule bulbar fossa covers entire sclera. Bulbar conjunctiva covers anterior sclera. If we can see from the anterior to the posterior, then we have seen this one a posterior to the anterior, then sclera, episclera, Tenon's capsule, and conjunctiva. Anatomy of the eye orbit. Orbit shape is pyramidal and volume is 30 ml. The two medial walls are parallel. Angle between the lateral and the medial wall is 45 degree in adults and 50 degree in newborn. That's why newborn orbit is divergent once developed by 4 years. The eyeball is contained on the base of the eye, the apex. It is inside. Roof has two bones. Roof has two bones. The eyeball have total formed by the 7 bones. Roof has two bones, frontal and the lesser wing of the sphenoid. Lateral wall is formed by the two bones, zygomatic and greater wing of sphenoid. Then medial wall is formed by the 4 bones from anterior to the posterior, maxilla, lacrimal, ethmoid, and body of sphenoid. Floor has 3 bones, palatine, zygomatic, and maxilla. Thickest or strongest wall of the eyeball is lateral wall, and thinnest and weakest wall is medial, and weakest point of the bone is floor, maxilla. There are 6 cranial nerves are associated with the eye. There are 2, 3, 4, 5, 6, and 7. 7 is not passed from the superior orbital fissure. It is indirectly associated with and supply the orbicularis oculi of the extraocular muscles. There are supraorbital canal and supraorbital fissure and the optic canal. The supraorbital fissure passes nerve passes lacrimal, frontal, third superior nerve, fourth occipital nerve, nasociliary nerve. From the optic canal, optic nerve and ophthalmic artery passes. Annulus of gene in apex. The 6th nerve is also passes an inferior optic vein. Fibrous tissue surrounding the supraorbital fissure and the optic canal is annulus tendinous ring of gene. It is the origin of the 4 recti muscles. Vascular supply of the eyeball. It is mainly supplied by the internal carotid artery branches, ophthalmic artery. There are 3 branches: anterior ciliary artery, posterior ciliary artery divided into longus posterior ciliary artery, 2 branches, and 15 to 20 branches of the short posterior ciliary artery, and the central retinal artery. It is entered through the optic nerve 1 cm behind the eyeball, supplies retina. Short posterior ciliary forms the Posterior ciliary forms anastomosis around optic disc gene halar. Posterior ciliary vessels and nerves are present in suprachoroidal space between sclera and the choroid. Long posterior ciliary and anterior ciliary form anastomosis known as arterial cycle. The arterial cycle, the major and the minor arterial cycle. Major arterial cycles are from the periphery and the minor arterial cycles are in the center. Venous drainage of the eyeball. Anterior plus posterior ciliary veins forms the four vertex veins, two superior plus cranial ciliary cranial vein, two inferior superior ophthalmic vein, the inferior ophthalmic vein, cavernous sinuses. Clinical aspects: blood in anterior chamber is known as the hyphema. Anterior ciliary bulbar conjunctiva. Limbus is the junction between the cornea and sclera. Anterior ciliary branches forms the plexus, conjunctival plexus, superficial episcleral plexus, and the deep episcleral plexus. Conjunctival plexus is formed in the conjunctivitis. Episcleritis involved in superficial episcleral vein plexus. A deep episcleral plexus keratitis, scleritis, anterior uveitis, and acute IOP. Superficial congestion, deep congestion, and subconjunctival hemorrhage. Superficial congestion is bright red in color and it is branching. Deep congestion, violet, dusky red, and it is radial and circumcorneal. Subconjunctival hemorrhage, it is bright red and diffuse. Its most common cause is blunt trauma, and risk factor is old age, hypertension, bleeding disorders, and treatment is conservative. Slowly it will remove. How to differentiate with the superficial congestion and the deep congestion? Topical phenylephrine drug can blend conjunctival and superficial scleral vein vessels.